Okay, we're going to get started in chapter 1. In all of the chapters in the text, and the text we're talking about is the Mansfield and Newman third edition, Essentials of Kinesiology for the Physical Therapist Assistant. So most of the lectures and the lecture portion of this course will be from this book. Some of your lab activities will be involved with the trail guide for the body. So in every chapter in this book has a list of key terms at the beginning of the chapter, and it's always a good idea to take a look at those terms and figure out which ones are new, which ones do you need to know, which ones do you need to learn. And every discussion is going to start with the terminology to define that subject. So with kinesiology, we're talking about the study of movement. So this course in this text is particularly intended to be a review of anatomy and movement and the musculoskeletal system that you've studied in anatomy and physiology. And then how does it move? What are the biomechanics involved? So in the first part of this chapter that we're going to talk about is kinematics and basic terminology, and then we're going to move into some other areas in chapter 1. So the learning objectives for this part of chapter 1 are to define some terms and to talk about some different types of movements. So we will go through all of these. So kinematics is the branch of biomechanics that is talking about movement without regard to the forces that cause that movement. So it might be gravity, it might be muscle force that's causing it, but at this point, we don't care. We will care later on in the chapter, but right now with kinematics, we're just talking about the movement. So they always talk about the movement of a body, and that doesn't necessarily mean like your whole body. They just mean a segment, or what's moving is the body. So with translation, the body's moving from point A to point B. And there are two different types of translation. Rectilinear motion, which is moving in a straight line. So that's the kid on the slide going straight down the fall line. Curvilinear motion, which is moving in a curved line. So that's the skier going down the hill, controlling their speed with that curvilinear motion. A lot of sports motions tend to be curvilinear, like throwing a ball, hitting a ball. It prescribes a curved path through space. And rotation is the movement of a body about an axis. So most of our joint movements are rotational movements. So in the picture, it's the elbow is the pivot joint, that's the axis, and the rotation around that axis is the movement that we're talking about. So active movements are movements that you do with your own muscle. Passive movements are movements that you do because something else is moving you. So like the kid on the sled, that's a passive movement. They're translating because of gravity going down the hill. Gravity and lack of friction because there's snow. With active movements, like the example in the PowerPoint is flexing an arm overhead, you're using your muscle to raise that arm. If the therapist is lifting that arm over your head, that's passive movement. So active versus passive. Is the muscle the prime mover, or is there another force that's the prime mover, like gravity or someone else lifting your arm, or your other arm lifting your arm? That's still a passive movement in the arm that's being lifted. So a lot of times we will talk about, and we'll talk a lot in physical therapy about active and passive range of motion, and we'll practice some movements in lab. So there's a whole group of terminology regarding the specific position of the body. So everything that we talk about is in reference to anatomical position. And in anatomical position, it's the human body standing on its feet, palms facing forward. So actually this guy in the diagram here, is not in anatomical position because his palms are facing towards him or even a little bit back. So if his palms were facing forward, that would be anatomical position. And that is our baseline for everything. So everything we describe is relative. A lot of the terminology that we're going to talk about within the body is one part relative to another. Something is toward the front of the body or toward the back of the body, or away from the midline or towards the midline. So a lot of the directions and terms we talk about are also paired. So anterior and posterior, anterior is toward the front of the body, posterior is toward the back of the body. We have this imaginary line coursing through vertically through the center of our body that we are going to refer to as the midline. Any movement toward the midline is referred to as medial, and movement away from the midline is referred to as lateral. So we can also talk about one part being anterior to another part, or posterior to another part, or medial or lateral to another part. So it's all about comparison. Comparison to the midline, comparison to the front or back of the body, comparison from where one part or one muscle is to another. So another group of paired terminologies, superior and inferior. So superior is above or more towards the head, and inferior is below or more towards the feet. Proximal is closer to or more towards the torso, and distal is farther away from the torso. And so that can also be relative. So I could say the wrist is distal to the elbow, and the elbow is distal to the shoulder, but the shoulder is proximal to the wrist. So whatever's nearer the torso is proximal, whatever's more away from the torso is distal. Another set of terms, which these terms are not as commonly used, they're used more with quadrupeds, cranial and caudal, or cephalad and caudal. So cephalic is the head, and AD is the term for towards or to. So cranial or cephalad is toward the head, and caudal is toward the feet or toward the tail in a quadruped. So you don't hear those terms quite as much anymore. You more often hear superior and inferior, but cranial and caudal are legit anatomical terms. So when we're talking about muscles, a lot of times we talk about their relationships to one another. One is superficial and one is deep. So superficial is more toward the surface or the skin of the body, and deep is more toward the inside or the core of the body. So you could say that the skin is superficial to the muscle, and the muscle is superficial to the bone, and conversely, the muscle is deep to the skin. And then we'll talk about the relationship of muscles, and one muscle is deep or superficial to another. So when we talk about all the different muscles, we're going to talk about their origin, insertion, action, and innervation, and their relationship to other muscles in the neighborhood. So the origin is going to be the proximal attachment of a ligament or muscle. So that is the one that is closer to the torso. When we start getting onto torso muscles, it gets a little confusing, but we'll talk about that when we talk about those individual muscles. The insertion is the distal attachment of a muscle or ligament. So sometimes you'll even hear it say superior attachment and inferior attachment, or proximal attachment and distal attachment, but origin and insertion are the most commonly used terms. In terms of the position of the whole body, if someone is lying prone, they're lying face down. If someone is lying supine, they're lying face up. So prone and supine are another pair. So a lot of these terms are in pairs, and we're going to continue talking about referring to things in the body by where they are in relationship to other things. And I want you to be able to use anatomical terminology because that is the correct terminology, and it makes everything clear. It makes it absolutely clear what you're saying and the relationships of those different structures.